We're going to begin discussion of survey and design principles for the Kennedy Class II partial denture. It has similarities to the Kennedy Class I because it has an extension base side. You will recognize some of these principles. The Kennedy Class I and II can be considered together as these are extension base RPDs and have different rules than those of the Kennedy Class III and IV, which are tooth-supported removable partial dentures. When we look at this arch form, we use the rule that you take the most posterior edentulous area to determine your classification. So that would be on the patient's right side from the premolar back. That extension base area is the most posterior to be replaced. So this is a unilateral edentulous area located posterior to the remaining natural teeth, or the definition of a Kennedy Class II. There is one additional edentulous area on the opposite side of the arch, so this would be a Kennedy Class II Modification 1. The fulcrum line for the Kennedy Class II is through the two most posterior teeth in the arch. These will be our primary abutment teeth and we'll clasp them. The second premolar, or the canine, can act as our secondary abutment to the Kennedy Class II. The secondary abutment tooth is the tooth anterior to the edentulous area on the tooth-supported side of the Kennedy Class II. If we look at a vector going perpendicular to the fulcrum line, then we would get our best retentive results by using the canine. For aesthetics, we might choose to clasp the second premolar, but if we're going to clasp the canine on the contralateral side of the arch, it just makes good sense to go ahead and clasp our canine. It also makes good sense because it is really the best choice of a tooth for our secondary abutment. When the patient eats sticky foods, the partial denture extension base wants to rotate around the fulcrum line in an occlusal direction. When the patient bites down on a bolus of food, the extension base again rotates around the fulcrum line, and the partial wants to lift off of that tooth anterior to the edentulous area on the tooth-supported side. So we will clasp that tooth also. There are 3 abutment teeth clasped for the Kennedy Class II RPD design. When the extension base wants to lift off of the tissues in an occlusal direction, it is counteracted by the retentive arms on the primary abutments, as well as any indirect retention that is located anterior to our fulcrum line. When the patient bites down on a bolus of food, the partial cannot lift off of that anterior abutment anterior to the edentulous area because of the clasping mechanism that is located in that position. A second movement is the rotation about a longitudinal axis that goes through the frontal plane and the distal extension. That movement is resisted by the rigidity of the major and minor connectors and its general ability to resist torque. A third movement is about an imaginary vertical axis that passes through the horizontal plane near the center of the dental arch. That movement is resisted by the stabilizing components, be they arms or plating, and the minor connectors that are in contact with the vertical surfaces. This arch form illustrates the tooth configuration typical to a Kennedy Class II on the mandible. The fulcrum line is the line through the most posterior teeth that will be used in our RPD design. The RPD will rotate around this fulcrum line when the bases move away from the extension base residual ridge. We clasp these 2 primary abutments. We will also clasp the tooth anterior to the edentulous area on the tooth-supported side of the arch, which is classified as our secondary abutment. Here are 4 different arch forms. The fulcrum line is designated in green. The fulcrum line traverses the primary abutments. The secondary abutment is designated with a red arrow. Note that the arch form on the upper right is a configuration where we place an implant on the edentulous side, and it becomes a primary abutment for our partial denture. This would have an abutment like a locator or an O-ring placed in it, and an attachment placed inside the final denture. The placement of an implant should be in line with the path of draw of the denture. Therefore, the bony contour of the arch must be considered when picking a site for the implant. A CT scan is helpful to make this decision. On the upper right side of the arch, where you have no modification space, teeth from that canine on back, it's best to separate retention as much as possible. You would clasp either the canine or the first premolar and the second molar. We choose the first premolar as it is more aesthetic than clasping on the canine. You will usually place direct retainers anterior and posterior to the edentulous areas. You would like to have retention anterior and posterior to our fulcrum line. We divide our abutments into two categories, the primary and the secondary abutments. The primary abutment in the Class 2 Mod 1 shown above are 1. The abutment adjacent to the extension base, and 2. The most distal abutment on the tooth-supported side of our partial denture design. The secondary abutment is the tooth anterior to the edentulous area on the tooth-supported side. The primary abutment, which is the distal abutment tooth on the tooth-supported side, can have rigid clasping because it's a strong molar, and we will want to use the cast circumferential clasp on it. Ideally, we would like to have distal buccal retention because it would be posterior to our fulcrum line, and all the retention on the abutments would be on the buccal surface, and this is ideal balanced retention. We could also use the distal lingual retention if there's no natural buccal retention on the tooth. When a molar has a tooth missing anterior to it, it has a tendency to lean to the mesial and to the lingual, with little, if any, retention on the distal buccal. We may use the ring clasp to get to the mesial lingual surface of our abutment tooth. This is a good solution when you would have to mutilate the tooth on the mesial lingual in order to get the first 2/3 of our direct retainer above the survey line. We may also use the mesial buccal undercut for retention when we wish to plate the tooth on the lingual and extend our major connector back to the distal surface of our abutment tooth. When we do this, though, we have to consider how far out away from the tissue the lingual part of that major connector must stand in order to clear that undercut created by that leaning molar. If it must stick way out, then the ring is a better solution over plating on the lingual. Remember, the reciprocal component must be all above the survey line and in the middle 1/3 ideally, so it is best placed on the surface with the lowest survey line. As long as we satisfy balanced retention on 2 of our 3 abutments, then the third can be on the opposite side. So we could have 2 buccals and 1 lingual retention. The only thing we can't have is buccal on one side and lingual on the other. The partial denture framework on the upper right is an example of a conventional direct retainer arm that is being used on the molar of a Kennedy Class 2 maxillary design. The maxillary molars tend to lean to the buccal and have a survey line very close to the gingiva on the lingual. This makes it ideal for a cast circumferential direct retainer to engage the distal buccal 0.01 undercut. The molar abutment on the mandibular is often tilted to the mesial and to the lingual, And we happen to find that the retentive position on the mesial lingual is the best position for our direct retainer. You look at it this way. If I put my direct retainer tip on the distal lingual, I have to have the first 2/3 of the direct retainer above the survey line. That survey line is so high on the mesial lingual that I have to really cut the surfaces of that tooth down to be able to make it so that the first 2/3 of my direct retainer is all above the survey line. So I use the most severe undercut position for the terminal end of my direct retainer, which would be the mesial lingual. That way I do not have to mutilate my tooth as much in order to get that direct retainer, the first 2/3 of it, to be above my survey line, as it has a lower survey line on that position on the tooth, and my 0.01 retentive part is below the survey line on the mesial and no higher than the middle third of the tooth. The secondary abutment on the tooth-supported side can be either a wrought wire clasp, a cast round, a cast circumferential, or sometimes an I-bar. Think about your fulcrum line and the force on the tooth as the edentulous extension base area is depressed under occlusion. As that depresses, the partial rotates about the fulcrum line and the tooth gets torqued to the lingual. The most kind treatment of the tooth is the wrought wire clasp, as it flexes more than a cast circumferential. We do need a 0.02 mesiofacial undercut in the cervical third, but not on the gingival margin. We must look at the condition of the tooth and the tissue. In this case, it's a canine, and that's a pretty strong tooth with an extremely long root. We must also look at the periodontal condition. How much of this tooth is in bone? The root form of the tooth is important. Do we have a short conical root or a short root like a premolar? Does it have a large amount of restoration in it that may compromise its strength under torquing forces? All of these factors influence the type of clasp we choose for this tooth. A maxillary abutment is not torqued as much because the support we will get from the major connector on the palate. The condition of the tuberosity is also a factor. If they have significant fibrous tissue covering them, they would depress more under function than one that is bony and small. All these factors guide us into the choice of a clasp on the secondary abutment. The more movement anticipated on the extension base, the more flexible the clasp must be. Here's an example of the wrought wire direct retainer, which would also have a distal rest and plating as a reciprocal component. This would be the kindest clasp to our tooth. The only problem with the wrought wire clasp is that it gets out of adjustment more easily as the patient tends to use it to remove the prosthesis. On this example, we have an anterior secondary abutment, but we have put a cast circumferential on it instead of a wrought wire. The reasoning behind that is this. The maxillary arch secondary abutment does not get as much torque as the mandibular because of the large amount of support the major connector provides by its extensive contact with the palate, and the palate does not resorb, so there are less torque forces exerted on the abutment. The distal extension side of the Class II RPD must utilize clasping that reduces torque to the distal abutment tooth. At ULSD, we must use one of 4 clasping mechanisms for retention on the extension base side of the mandibular Class II design. Listed on this page are the 4 clasping mechanisms that you can use for the extension base side of the removable partial denture for the Kennedy Class II. We will discuss each one of these in detail. The first and most preferable of the 4 systems is the RPI, as described by Arthur Kroll. I-bar emerges from the base attachment area from a distance that is a minimum of 1 tooth length from the distal abutment usually from a solid bar of the base attachment, so that it casts with better accuracy. At its origin, it is wider and tapers to its terminus. It runs horizontal to the crest of the ridge, and as it exits the acrylic resin, it is approximately 2 to 2.5 millimeters in width. It is an infrabulge clasp, so it approaches the tooth from the apical direction. It turns upward in the form of a curved right angle at the middle of the tooth or slightly mesial to the middle of the tooth. It engages the .01 undercut and then extends upward to the survey line. It contacts the tooth in the form of a pod that is a minimum of 2 to 3 millimeters in height, occlusogingivally. The principle of encirclement, as it applies to the bar clasp, indicates that you must have at least 3 widely spaced areas of tooth contact, which embraces more than 1/2 of the tooth's circumference. This is illustrated on the image to the left. As far as placement specifications for the RPI system, the bottom of the approach arm of the eye bar should be a minimum of 6 millimeters from the marginal gingiva. This allows the superior border of the approach arm to avoid the marginal gingiva by a minimum of 3 to 4 millimeters if the width of that arm is 2 to 2.5 millimeters in width as it exits the flange area. This illustrates that the guiding plane is prepared through an area of 2 to 3 millimeters from the marginal ridge apically. The guiding plate is placed 1 millimeter above the bottom of the guide plane and touches the tooth through at least 1 millimeter. The laboratory will prepare the cast to provide at least a 4 millimeter opening beneath the guiding plate. This space allows for food and debris to escape and not to be jammed into the sulcus. This space also allows the partial to depress under masticatory forces, and the guide plate then rotates toward the tooth but does not torque the tooth. The framework rotates around the mesial rest toward the long axis of the tooth, and the eye bar actually disengages the tooth. Therefore, you do not get torquing forces on the abutment. This is the whole idea of the RPI concept. Note that the guide plate extends to the lingual to a position where it is lingual to the buccal lingual height of contour, thus trapping the tooth from moving lingually when the eye bar flexes into the .01 undercut. The guide plate, minor connector, and rest act as a reciprocating component of the clasp assembly. The dip down on the lingual must avoid the marginal gingiva by a minimum of 3 millimeters, and the lingual bar major connector must be at least 5 millimeters in width. If the space to the floor of the mouth is not 8 millimeters, then you must plate the lingual on the survey line, which provides minimal torque, or consider another clasping mechanism. A view from the lingual aspect of the RPI clasp system reveals a mechanism for reciprocation for the clasp assembly. First of all, the guide plate extends lingually past the buccal lingual height of contour on the distal surface of the tooth, and it functions to trap the tooth from moving to the lingual when the eye bar flexes into the .01 undercut. The minor connector also aids in this reciprocation action. We can use a bar clasp except when the following contraindications exist. If there's a tissue undercut of greater than 1.5 millimeters at the inferior border of the approach arm, the bar would be contraindicated because the bar would stick out and the mucosa of the inner cheek under function would rub against the bottom of the bar and be irritated. We can also not use the bar if there's a real high frenum attachment because the function, when the frenum or the muscle is in function, it would drag along the bottom of the bar and it would be cut. If the tooth is extremely bulbous, then it is highly likely that that bar would extend out away from the mucosa and cause the same problem that we talked about with an undercut greater than 1.5. That's also true when the tooth is very buccally inclined. The last contraindication would be if we don't have an undercut at the appropriate surface of the bar we're intending to use, then we cannot use that bar. One of the 4 clasps for use on the distal extension removable partial denture is the modified T-bar clasp. It has an embrasure rest on the mesial of the abutment tooth next to the edentulous area and a distal rest on the tooth just anterior to it. There is a distal guide plate, and the lingual drops away with the guide plate and the minor connector providing reciprocation in a manner the same as we discussed on that RPI slide. The T-bar is used when we have a 0.01 retention on the distal facial surface of the tooth and when a bar clasp is not contraindicated. Observe the different components of the modified T-bar. Point A is the horizontal part of the bar that originates from the strut in the base attachment area. It runs parallel to the crest of the ridge, and then at point B it makes a rounded right angle and goes straight up, and it should be at the middle of the tooth, buccal mesiodistally. And as the bar passes the marginal gingiva, note that it is perpendicular to the marginal gingiva. The first point of touching at point D is above the survey line for this T part of the bar, and then the little retentive tip swings back into your 0.01 undercut. A good point of observation for this is to look at the lower illustration. The modified T-bar clasp assembly has an embrasure rest, which includes a mesial rest on the abutment tooth and a distal rest on the tooth anterior to it. The modified T-bar has many of the same specifications of the I-bar in the approach arm area. That is, it avoids the marginal gingiva by 3 to 4 millimeters, and the bottom border of the approach arm is 6 millimeters below marginal gingiva. It's 2 to 2.5 millimeters wide as it exits the base. It makes a rounded right turn at the middle of the tooth mesiodistally and engages the tooth at or above the survey line, and only the retentive portion goes into the 0.01 undercut on the distal-facial surface. The guiding plane is prepared to extend a minimum of 2 to 3 millimeters below the marginal ridge of the abutment tooth. The distal guide plate extends superiorly at least 1 millimeter above the bottom of the guiding plane. The plate is relieved in the gingival 4 millimeters to allow for debris and plaque to escape on the buccal or lingual rather than pack food into the sulcus. It also allows the plate to rotate toward the tooth when a force is applied to the distal extension area of the prosthesis. A view from the lingual aspect of the modified T-bar clasp reveals the mechanism of reciprocation for the clasp assembly. The guide plate extends lingually past the buccal lingual height of contour on the distal surface of the tooth. It, along with the minor connector leading to the rest, functions to trap the tooth from moving lingually when the modified T-bar flexes into the undercut on the distal facial surface of the tooth. The framework dips down to avoid the marginal gingiva by a minimum of 3 millimeters. The major connector must be a minimum of 5 millimeters wide at this point for strength of the prosthesis, or if that is not present, you must plate the tooth at the survey line. The combination clasping system has a distal guide plate leading to a distal occlusal rest next to the edentulous area. The direct retainer is a wrought wire clasp that originates from the distal guide plate area and then descends to engage a 0.02 mesiofacial undercut. The first half of the wrought wire clasp should be on or slightly above the survey line, and the terminal half of the direct retainer goes below the survey line to the 0.02 mesiofacial undercut. The reciprocal component is a lingual plate or a lingual arm positioned 1 millimeter above the survey line. The lingual plate is preferable. If the arm is used, the major connector must dip down and avoid the marginal gingiva by a minimum of 3 millimeters, and the major connector must be a minimum of 5 millimeters in width for strength of the prosthesis. If there's not 8 millimeters of space between the functional floor of the mouth and the marginal gingiva, then plating has to be used. One of the wrought wire's shortcomings is that it gets out of position easily as the patient uses the clasp for repeated insertion and removal of the prosthesis. The indication for use of this clasp is when you have an extension base area on your design and you want a clasp that is flexible because of anticipated movement of the base under function. On this slide, we have two illustrations of the combination clasp. On the left is the buccal surface. You can see that the wrought wire originates at least a centimeter posterior to the natural tooth where it is soldered to the framework in the base attachment area. That wire comes forward and basically on the lingual aspect of the guide plate, it turns up to the occlusal surface, and then it originates from the occlusal, coming down above the survey line, but about halfway it will go under the survey line into a .02 undercut and come back up the side of the tooth in sort of a J-shaped, or in this case a backward J, or reminding you of a ski jump area on a slope. It goes down and then the skier goes back up in the air and off the edge of that ramp. So this provides more retention if we have half of it under the survey line and this J short sort of shape. On the lingual aspect, we would have a reciprocal arm that is a cast circumferential originating at the distal rest and coming forward all above the survey line at least 1 millimeter and approximately in the middle third of the tooth. Please note that the wrought wire has a distal rest, which is different from our others. The last clasping system that we'll talk about using at ULSD is the reverse circlet clasp, sometimes called the interproximal ring clasp. This particular direct retainer engages a .01 distal facial undercut, and it originates from the suprabulge area of the tooth. It has a mesial rest, a distal proximal plate, and either reciprocating component can be lingual plate or a lingual arm. The fourth acceptable clasp for use on the extension-based RPD is the reverse circlet clasp, or another name is the interproximal ring clasp. It has normally a mesial rest. Sometimes we might put an embrasure rest when there's a possibility of wedging between the two teeth. The direct retainer is a cast circumferential clasp that's origin is drawn on the survey line and then it dips into a .01 distal facial undercut. The guide plane and the guide plate are prepared as in the previous clasp assemblies that we discussed. The reciprocal component is also a cast clasp arm that is drawn on the survey line. The partial dips 3 to 4 millimeters below the marginal gingiva, and the lingual bar at that point must be a minimum of 5 millimeters in width in order to provide strength for the prosthesis. If there's insufficient room, we plate the tooth at the survey line. This shows the example of the reverse circlet clasp. A cast circumferential direct retainer engages the distal facial .01 undercut. When the distal extension is loaded, the rotation of the mesial rest directs forces through the long axis of the tooth. The direct retainer arm disengages the tooth if the proximal portion of the retainer arm is placed at the survey line. It is not used on the maxillary premolars because it is not very aesthetic, and you can see an example of how this would look on the upper right picture with the dentiform. The hairpin, or reverse action clasp, is another clasping system that may be used, but is not one of the preferred systems that we use here at ULSD. The hairpin clasp originates and ends on the same surface of the tooth. It may originate with the first half of the direct retainer above the survey line on the superbulge area. It then reverses its direction at the middle of the tooth, and the terminal half of the clasp arm approaches the undercut in the infrabulge area. The problem with this clasp is that when the force is applied to the extension base, the direct retainer, which is above the survey line at its origin, places a force on the tooth at this position. If the distal rest is used on the tooth, the force can direct movement of the abutment tooth toward the posterior edentulous area. This movement can be somewhat counteracted by placement of a rest on the mesial aspect of the tooth. The direct retainer would then have to originate off of the guide plate, which must extend up to the marginal ridge. We don't use this very often. The indirect retainer is that unit of the partial denture that assists the direct retainer in such a manner as to resist rotation of the distal extension part of the partial in an occlusal direction. The key word in this definition is the word rotation. The partial denture wants to rotate around an axis that is positioned on the two primary abutment teeth, which are the most posterior teeth next to the edentulous area used in the design. The axis of rotation is shown by the green line. When a person eats sticky foods on the extension base area of the prosthesis, the partial denture wants to rotate around this axis of rotation or fulcrum line. The component part that prevents that rotation is the indirect retainer, shown at the yellow arrow. Indirect retainers are rests that are placed into positive, prepared rest seats at a position as far away from the fulcrum line as possible. They may be part of a clasp assembly. In order to determine the position of the indirect retainer, you must place it perpendicular to the fulcrum line. The indirect retainer is placed at a position that is the farthest away from the fulcrum line. The example shown would have one on the lateral or on the canine. We are already placing a clasp assembly on the canine secondary abutment, so that rest will act as a component of the clasp assembly and as an indirect retainer. An indirect retainer must be located on a prepared rest seat that provides positive vertical support. When the partial wants to rotate around the fulcrum line, the rest engages the tooth in such a manner that it will not allow the abutment tooth to reposition itself toward the facial under pressure. The indirect retainer must be placed on a tooth capable of supporting the function of an indirect retainer. You will not use them on mandibular, lateral, or central incisors. On the maxillary, you will find an indirect retainer placed on the maxillary central incisor if it does not interfere with occlusion and has a developed cingulum. You will not place them on lateral incisors on the maxillary arch. There are factors influencing the effectiveness of indirect retainers. If rests are held securely in their rest seats by the direct retainers, rotation about an axis will occur, which activates the indirect retainers. If there's total displacement of the rest, there would be no rotation about the fulcrum, and the indirect retainers would not be active. There are factors influencing the effectiveness of indirect retainers. The distance of the indirect retainer from the fulcrum line is a factor, and three things must be considered. A, the length of the distal extension, B, the location of the fulcrum line itself, and C, how far is the indirect retainer from the fulcrum line. The rigidity of the connectors supporting the indirect retainers may be a factor that influences its effectiveness. All connectors have to be rigid if the indirect retainer is to function as it's intended. The effectiveness of the supporting tooth surface influences the effectiveness of indirect retainers. The indirect retainer must be placed on a definite rest seat on which movement of the rest or the tooth will not occur. Plating on teeth on the inclines where you have a lack of a positive rest seat are not indirect retainers. Also, weak teeth or periodontally compromised teeth are not good indications for indirect retainers. There are some auxiliary functions of indirect retainers. The indirect retainer can reduce the anterior-posterior tilting leverages on the principal abutment teeth if they're properly placed in the rest seats. Also, the minor connectors contact the axial surfaces of the teeth and aid in their stabilization against horizontal forces of movement due to mastication and occlusion or parafunctional activity. A third is that the anterior teeth that are supported with an indirect retainer are definitely stabilized against lingual movement of those anterior teeth. And lastly, an indirect retainer can act as an auxiliary rest to help support a long major connector. You have a major connector from second premolar to second premolar. Those auxiliary rests or indirect retainers act as auxiliary rests for you. The best position for the indirect retainer on this case is probably on the central incisor, if we allow for all the rules of mechanical advantage. But notice the occlusal wear on these teeth. We may have a very deep bite. I hope so, or otherwise the designer of the major connector doesn't know the rules about placement of the major connector's superior borders. We may move over to the canine or the first premolar if the occlusion is a factor. We often use the mesial fossa of the first premolar, especially on the mandibular arch, because of its aesthetic and occlusion advantages. The mesial of the second premolar offers very little advantage over the distal of the second premolar in this case, which is part of the actual anterior clasp assembly on that side of the arch. The distal rest on the second premolar may act as an indirect retainer, even though it is closer to the fulcrum line than we would like. I would not want a major connector plating to be resting below the cingulums on these anterior teeth. I would prefer dipping away and allowing the major connector not to sit on the gingival margin. It will drive plaque and debris into the sulcus, and it can cause damage to the gingival margin if there's not enough occlusal support. The major connector should ideally cover the cingulums and extend from contact point to contact point. An anterior-posterior palatal strap is also a better major connector on this particular case because of the support that posterior strap offers the prosthesis. This is an example of a canine extension rest from the occlusal rest on the mesial of the first premolar. This extension should always be on a prepared rest seat. It should not rest on an incline. It can be used as an indirect retainer, but I'm not sure what advantage it offers over just using the mesial rest of the first premolar for indirect retention. It can interfere with occlusion. If it were probably up to me, I would have just used the canine rest or the mesial occlusal rest and omit the other one that I didn't use. When we draw our perpendicular to the fulcrum line, the tooth indicated for the indirect retainer is our lateral incisor, but we do not place them on laterals and centrals on the mandibular arch. So we move over to the canine to place our indirect retainer. Canines are used when the mesial rest of the first premolar is too close to the fulcrum line or when teeth are overlapped. The first premolar is the desired location because occlusion is not usually a factor and it is more aesthetic. An incisal rest on the canine or an acid etch, a composite cingulum rest, may be used on mandibular canines. We do not normally cut a cingulum rest into the lingual of the mandibular canine as the enamel is very thin in that area and a naturally developed cingulum usually is not present. The incisal rest may be used if the patient does not have a problem with aesthetics. Acid etch cingulum rests must be properly executed or they will not hold up. The mesial rest of the first premolar should be considered because of all of its advantages. Continuous bars and lingual plates are not indirect retainers, even though they may aid in indirect retention. An indirect retainer is a rest in a positive rest seat. In this case, it appears to be on the mesial of tooth number 29. The best position for the indirect retainer would have been tooth number 27, because it is a position farthest away from the fulcrum line. It's difficult to tell whether there's a cingulum rest under that major connector, but the cingulum does not appear to be covered by the metal plate as it should be. Remember, the indirect retainer is usually placed close to a line drawn perpendicular to the fulcrum line and as far away from the fulcrum line as possible. The end of the arrow is the point farthest away from the fulcrum line. Therefore, the canine would be the ideal point of indirect retention. The mandibular canine would be eligible for an incisal rest, whereas the maxillary canine is not appropriate for an incisal rest, as it would be very unesthetic. Sometimes the occlusal rest on the secondary abutment in a Class II design may serve as the indirect retainer, if it is far enough from the fulcrum line and provides support for the major connector. Our desired point on the canine is so close to the secondary abutment for tooth-supported side that it is not necessary to put an additional rest on the canine. This is an example of the occlusal rest on the secondary abutment being able to act as an indirect retainer because it lies far enough from the fulcrum line and provides good support for the major connector. If only one tooth is missing on the modification side and there is a two-tooth difference in the ideal location of the indirect retainer, then an additional rest is indicated to aid in the support of the major connector and to act as the indirect retainer. The occlusal rest on the second premolar is too close to the fulcrum line to be very effective. Therefore, the indirect retainer should be placed on the canine number 27 because it is the farthest point from the fulcrum and it will also aid in support of a very long major connector. The mesial fossa of the first premolar may be substituted for the canine for aesthetics and occlusal interference. That auxiliary rest on the first premolar is needed for indirect retention and for support of the under-supported long span major connector. When you have a Class II that has no modifications on the tooth-supported side, you should separate your retention as much as possible and place clasp assemblies as far away from the fulcrum line anteriorly and one posterior to the fulcrum line. You would not usually clasp your third molars if the second molar is present. So your primary abutments would be the second molar on the tooth-supported side and the canine on the extension base side. Your secondary abutment would be either the canine or the first premolar on the tooth-supported side. Clasp assemblies are placed on the primary and secondary abutments. The premolar was chosen because of aesthetic consideration. The distal rest on tooth number 13 may act as your indirect retainer. You may place an additional rest on the canine as your indirect retainer if you feel like you want the partial to be more symmetrical, and it does provide indirect retention farther away from the fulcrum line. This partial does have a very long extension base area on the opposite side, so that rest may clinically be more effective. The major connector of choice on the maxillary arch is the anterior-posterior palatal strap. If we avoid the anterior plating, the borders of the anterior strap must be placed in the valley between the rugae to create a smooth transition between the metal and the tissue. We should also keep the anterior border away from the speech zone. The strap must be a minimum of 8 to 10 millimeters in width. The posterior border of the posterior strap must not be posterior to the vibrating line, and it too should be a minimum of 8 millimeters in width. The clasp on the tooth-supported side of this design are cast circumferential clasps. The clasp on the extension base side of the maxillary could be either a wrought wire or a cast circumferential. I chose the cast C because the canine is restorative free, it's in good condition periodontally, and it has a very long root. Plus, I get a lot of help from that posterior strap of my major connector, which aids in both support and helps to avoid torquing on the abutment teeth. The patient will invariably use that clasp to remove the prosthesis, and the wrought wire gets out of adjustment too easily after multiple insertions and removals. The mandibular major connector is either a lingual plate or a lingual bar. The width of the lingual bar must be a minimum of 5 millimeters. The superior border must fall at least 3 millimeters below the marginal gingiva. If there is not 8 millimeters of space between the marginal gingiva and the functional floor of the mouth, then the lingual plate must be used. The lower border of the lingual bar must be placed at the functional floor of the mouth. You ask the patient to lift his tongue to the roof of his mouth, and you measure with a perio probe from the marginal gingiva to the functional floor. You can't use your cast as a guide. The upper border depends upon the amount of room you have from the floor of the mouth to the marginal gingiva. The bar must be at least 5 millimeters wide, and you must avoid the marginal gingiva by a minimum of 3 millimeters, but the important part is that you place the lower border at the functional floor of the mouth. It is less annoying to the patient if it is kept as low as possible. If there is a minimum of 8 millimeters of space between the functional floor of the mouth and the marginal gingiva, then a lingual bar may be used. But if there's less than 8 millimeters of space between the functional floor of the mouth and the marginal gingiva, it requires that a lingual plate be used. The inferior border of the lingual plate is placed at the functional floor of the mouth. The superior border of the lingual plate major connector is scalloped. It covers the cingulums and it extends from embrasure to embrasure, from contact point to contact point around the anterior part of the arch. I'd like to make some suggestions. Go to youtube.com and search for my channel, which is Ann Winshee. Review the survey and design seminar tapes for the Kennedy Class II, maxillary, and mandibular cast. There are 2 casts and 4 tapes each. Print the screen forms that are shown on the next 2 slides and actually do the drawings of the designs with the tapes. It will make you aware of the rules for proper placement of component parts of the partial denture. You will be able to recognize good and poor lab work when you see it. Believe me, this is going to affect the success that you have as a dentist.